here in the Waycross Community Media Studios with Kimberly Chelf, who is newly part of the Forest Park Fire Department. And Kimberly, tell us what your role is now as part of the fire department.
Hi, yeah, I am the community health educator with the fire department. So it's my job to help educate the community on all things health related.
Excellent. Why you're here today is because it's been a little while since we have talked about COVID. And to one degree, that's because we're all sick of talking about COVID. But there is a lot of new information. There are new things happening. And it's been a while since we've put out any kind of education or information about this. So thank you for coming in to make sure we could be all caught up and educated and informed about what's happening.
It's my pleasure. And it's a good time to do it. We're headed into the holiday season. People are getting back together. They're gathering with their families. And it's a great time to kind of go over what we should be doing to all stay safe.
Exactly. I guess the first thing I'll mention is we've been learning the Greek alphabet lately, right? With such an educational virus we have. So we're all the way up to what now?
We are at the Omicron variant. So the WHO, which is the World Health Organization, names variants of concern, and they give them a letter of the Greek alphabet to keep them separate from each other. So this summer we started to hear about Delta, and now we're starting to hear about Omicron. So that's where we are. I think they skipped a few in there, probably for some logistical reasons.
Yes.
But yes, we are at the Omicron variant.
Yes, and if you know the Greek alphabet and you're thinking, oh my goodness, we're all the way up to here. Yes, they did skip a couple because it probably wasn't that helpful to call it the new variant. How helpful is that?
That would have been really confusing for everybody.
Exactly, and there's enough to be confused about here. So that we're not confused, tell us a little bit about some of the things that we should be aware of now.
Right. So the Omicron variant was first identified in South Africa, although we're not sure if that's where it developed or if that's just where they found it first. Right now, we don't know a whole lot about it, so we're still learning. Everybody's getting to watch science happen in real time. And so a few of the things that we do know. So far, the Omicron variant, the symptoms are pretty similar to what we've seen with the other versions of COVID that we've had. So sore throat, runny nose, cough, headache, tiredness, nothing really new there. It does appear right now that it's a little bit more transmissible than other versions. So we all talked about how Delta was much more infectious than regular COVID. It looks like Omicron is even more infectious than the Delta variant. But they're still trying to gather data and confirm that. The other thing is right now, it looks like it's not more severe than Delta. So it's not gonna make you sicker, but it will be more easily passed from person to person than previous versions. We also don't know a lot about how this current variant is gonna interact with our vaccines that we have. South Africa is where we have the most data out of, and they have a very, very low vaccination rate. So we can't extrapolate or make a lot of assumptions about how the vaccine interacts with this variant because they only have about 20% of their population vaccinated. But it looks like there's a chance that the vaccines will be less effective against this variant, but we don't know for sure. It does seem, based on some information we have out of Israel that is very vaccinated, that if you are vaccinated and you get infected with the Omicron variant, you won't get sick enough to need to go to the hospital. So that's a positive. We do see that continuing. The vaccines will keep you from having a severe illness with COVID, no matter what variant you get. But it does seem like early data suggests that you're more likely to have what's called a breakthrough case with Omicron. So get COVID even if you're fully vaccinated, but we're not entirely sure yet.
And if you're listening and you're hearing a lot of most likely to or seems to, like you said, we are watching science happen. Most of the things that the general public, those of us who are not in fields of science, most of the time we hear something that's related to science, we learn about it long after someone's been studying it for 100 years and it's old news and we know most of the stuff about it. It's a new thing for those of us who are not in fields of science because we're watching the scientific community say, okay, this is new. We think it does this. Ha! We have new information. We now know it does this. Some folks aren't used to that. And it looks like contradictions, but really, we're watching science happen. How exciting is that?
I mean, this is the first time for, I would say, 90% of the people alive right now that we've watched a pandemic of this scale happen, especially with the science that we have now. So we have the ability, we can sequence these virus genomes really, really quickly. So before, it might take 20 years to realize that it was a different strain of the flu. Now we can do it in a week. But yeah, there's a lot of, we think this, but we're not sure, we're still waiting. And that's really hard for people because you're used to hearing, this is what it is. And we just don't know. I mean, this variant was identified, I think, maybe 2 weeks ago. So all of the data that we have is very, very early. It's going back and trying to look at things and catch up. I mean, they've already decided that we identified it a couple of weeks ago, but it was around before that. So they've gone back and tested samples from the weeks before they officially identified it and found that this variant was there. So it's, and now they're going back farther. So it's kind of, this process of learning and, making an educated guess, but it's still a lot of uncertainty. There's still a lot of just having to do the best you can and then changing as you learn more.
And because of that, like you said, we know a couple things. We know that thanks to the high vaccination rate in Israel, we know that you can be vaccinated and still get it. But we also know that it looks like if you're vaccinated and you get it, you won't get as sick. That's really a big, important thing to know.
Yeah, and that's the same as it was with Delta, right? So when Delta first popped up, everybody, was saying, like, you might still get sick if you're vaccinated, but you won't end up in the hospital. And that seems to be the same with Omicron. And that's because the vaccine teaches your immune system how to deal with this virus so that even if you do get infected, you don't get as sick as you would if you had never seen the virus before in your immune system.
That's really good news here because here in Hamilton County, vaccines are very available. Unfortunately, that's why we don't have that data out of South Africa. It's taking longer for them to get vaccines, so hopefully that'll change soon. But we don't have to wait for that here. There are lots of vaccines. The Hamilton County Public Health has lots of locations available where you can get that vaccine. And as we go into the holidays, I know the next thing we want to talk about is why is this relevant right now? Why do we want to talk about this right now? And one of the reasons for that is we're going into a season of getting together with large groups of people. So now is a really good time to know about these things and should we get vaccinated? Now, what about folks that they got their vaccine and they got their second shot? What should they be looking at doing now?
So there's a few things that we know work. No matter what variant of COVID we're talking about, no matter what we're doing, there's a few things that we know will help keep you from getting sick. One of those is wear your mask. If you're in public, if you're at the grocery store, if you're shopping for Christmas presents, if you're at a Christmas concert or a parade or a tree lighting ceremony, wear a mask. I know we're all kind of tired of it. It's not the most fun thing in the world, but maybe find some fun festive ones and make the best of it because that's a great way, even if you're vaccinated, to help add an extra layer of protection. The second thing that you can do is make sure that you're fully vaccinated. Make sure that you've had both doses of either the Pfizer or the Moderna vaccine or one dose of the Johnson & Johnson. And right now, anybody who's 18 or up can get their booster shot. So they're recommending that as well. So we want you to be fully vaccinated plus a booster if you're 18 years or older. If you're under 18, so if you're between 5 and 18, you should be fully vaccinated with 2 doses of the Pfizer. So
and folks have asked, we talked about masks and social distancing before, and then we stopped. Why are we talking about it again? And you answered one of those reasons. One of those reasons is there's a new variant, and there's some things we don't know. But we do know, statistically, that the masks and the social distancing really cut down on the transmissibility of the virus.
One of the things that we talk about in public health with prevention is like Swiss cheese layers. If you remember way back in early 2020, Dr. Amy Acton talked a lot about Swiss cheese and layers of protection, and that's what this is. The vaccine is a great sort of base layer of protection. It's gonna give you a really good basic layer, but the more extra layers we can put on top of that, the more protected we are. And when we have a new variant that we're not entirely sure how it's working or what it's doing, the more layers of protection you can put on, the better. Think of it as if you're shipping a Christmas present to your grandma across the country. You can put it in a box, right? And that's great. But if it's breakable, you're gonna probably wrap it in some bubble wrap, maybe put some tissue paper in there, maybe even put it in a box to really protect it so it gets there. This is the same thing. We wanna make sure that we stay healthy over the holiday season, so we really wanna layer on those protections. So vaccine is the first one, masking is the second one, and then being cognizant or thinking about the number of people that we're gathering with and the spaces that we're gathering in. So everybody wants to get together with their families. Last year was definitely a weird year for everybody. Everybody's excited to go back to normal this year, but maybe don't go all the way back to normal. Let's think about, who are we gathering with? Let's keep those gatherings, a little smaller than maybe 2019. Doesn't have to be as small as 2020. And some basic tenets that we've all kind of come to know are still applicable, right? Outside is best. Keep people spread apart as much as you can. If you can't stay spread apart, wear masks. If you have to be indoors, have some ventilation, maybe open a window if it's not too cold. Or instead of having everybody in one room, maybe have them in a couple of different rooms. So those sorts of things can help too. And then, making sure that if anybody is coming and they're feeling sick, now rapid tests are readily available. Do a COVID test just to make sure. It's wintertime, everybody has the sniffles, there's colds, there's all sorts of things going around, but make sure that it's not COVID. Don't just assume it's not COVID, make sure it's not COVID. Because right now we're starting to see a little bit of a spike in cases in Hamilton County, and most likely that's because of gatherings over Thanksgiving where the virus was able to spread. We don't want to see that same thing happen after Christmas. So I will say at the firehouse, we do have free rapid at-home COVID tests available. So if folks want to get a couple in anticipation of going to grandma's house for Christmas, just let us know, we can provide that. They're also generally available at Kroger, CVS, Meijer, Walgreens, pretty much any pharmacy generally has some. Or you can go ahead and make an appointment with a lot of different places and get the PCR COVID test. That'll take a little bit longer to come back, but any of those are great options before you go to a big holiday gathering to make sure that you're not inadvertently bringing COVID with you. Nobody likes an unexpected +1.
Yeah, we're on one hand, we're so tired of talking about this, but we are still seeing news stories of big events. I know there was just a Comic-Con in New York, and then there was a lot of cases tested at that one. And so as we go into, like you said, concerts, and we're all squished in together, and family events where we all squish into someone's living room. And there's an added element to those that when you go to a family event, you're going to have your much older relatives who might have a harder time fighting off something, and the babies who can't get vaccinated yet. There are some folks that have another health condition and they can't get vaccinated because of that. So these extra steps, I love that you mentioned there are some festive masks. I have been out for Waycross recording holiday events in Forest Park, in Green Hills, and in the area. I have seen some amazing masks. You're missing out if you are not choosing a mask to be part of your accessories with your outfit. I've seen them with sequins, and I've seen light up ones at outside events. So the masks, they're not as comfortable to wear because we're just not used to it, but you can find one that works, and it becomes part of your fun for the weekend too. So.
And it's a great point to think about. Kids under 5 can't be vaccinated. So while you may not know the vaccine status of everybody who's at your family holiday gathering, if there's a kid who is 4 or 3 or an infant, we know they're not vaccinated, and we really want to protect them. One of the concerning pieces of data with this new variant is that at least in South Africa, about 10% of all of their hospitalizations are in kids under 2, which is a new thing. That is a difference from what we've seen previously. Generally, up until now, kids haven't really been that affected by the COVID-19. But it looks like with this variant, for some reason, it's affecting kids a little bit more strongly than previous ones, and they can't be vaccinated. So we really need to protect them. And no kid wants to be sick on Christmas.
No.
That's the worst thing.
No, and wouldn't it break, as a mom, I think, oh my gosh, if I knew there was a thing that would have kept my kid from being so miserable, I would do it. So, little ones, they don't keep their masks on. They don't know how. So it just gives us a few extra steps to make sure that they're safe and the people they live with, that they could bring it home with, are safe. And that's a good point. This is new. That's why it's so important to make sure we keep up with new information. We kind of get used to thinking, well, it's all right. Kids are pretty safe anyway. This new variant affects kids differently. So it means pay attention. What are the rules? How do we keep safe? And how do we have a great Christmas with nobody sick, which is the key here.
And going back to those things that we've all known for a lot of years, right? Wash your hands. If you're sick, stay home. Cover your mouth when you cough. All of those kind of basic things that you learn in preschool, like those still apply. They're really effective. The reason that we all learn them in preschool is because they're really effective ways to prevent all sorts of diseases. The flu, cold, strep throat, all of that. Those things are great, and it's great to practice with your kids. I have a 4-year-old and a 6-year-old, and we talk all the time about washing their hands, about wearing their masks, about covering their mouths when they cough. And that's something that we'll continue to do long after COVID is over, just because it's good practice. But it's especially important right now. And another thing, is I know everybody's very excited about UC football and playing in the college football playoffs. I'm sure lots of people will be gathering to watch that game on New Year's Eve. And that's another time to really think about putting those practices into place. So, making sure that, folks are not too packed together, that you're wearing your masks if you can, that nobody there has, COVID symptoms. And if they do, maybe have them take a rapid test.
There are events that we don't think of as, we think, oh, well, a conference, that's a spreader event. But then we're going to get together with our friends and not think about, who does what during the day with what other groups of people, and who is going to go home to someone who lives with a great-grandmother or something like that. So as tired as we are about thinking about these things, that's why I'm so glad that you're here in the studio, because it's time to do. It's been a while. We all thought, well, we've said everything we need to say about COVID. Let's not make any COVID programs anymore. No, unfortunately, there's new things to learn. But fortunately, Forest Park has someone specifically to help keep Forest Park healthy. And that's why you're there in the fire department. If residents of Forest Park have questions, is there a way they can contact you?
They can. They can email me. So my email address is kchelf, C as in Charlie, HELF as in Frank, at forestpark.org. Or they can call the firehouse and ask for me. They can call, my direct line is 513-595-5272. Or they can call the main firehouse number and just ask to speak with me, and I'm more than happy to answer questions. Like I said, we also have free at-home COVID test kits if they want to do that before they get together with their family. That's always great. I have those available. Just give me a call and we can set up a time to pass those to you. And yeah, a lot of times I do get people that just want to ask a question or two, and that's totally fine. That's why I'm here.
That's really important. We only had time to cover a few things today. But I wanted to make sure that if you're watching this and you have questions and you think, well, they didn't answer this, or I'm planning this and I need to know if this is a good idea, or how do I get vaccinated, or is it okay for me to get vaccinated if I have this happening, or people have a lot of different questions. So this is a person that you can send Kim an email, send Kim, give her a phone call. And there is a resource in Forest Park. You can have an actual person. You don't have to just hope you're finding a good source when you're looking things up, which I'll just remind you, always check your sources of information. Make sure you're getting it from Hamilton County Public Health, CDC, And these are, you're picking good sources and then you're finding that information to share with Forest Park. So thank you so much for coming in.
You're welcome. It's my pleasure.